On April 1, 2026, the MV Hondius, a Dutch-flagged expedition cruise ship, departed from Ushuaia, Argentina, carrying nearly 150 passengers from 23 different countries. Their route was exotic and remote, cutting through the South Atlantic, past Antarctica, through islands so isolated that most people couldn't find them on a map. It sounded like a dream. Somewhere on that journey, a nightmare quietly boarded the ship. On April 11, just 10 days into the voyage, a passenger died. It wasn't an accident. It wasn't a heart attack. It was something that medical scientists had studied for decades, but had never expected to find spreading on a cruise ship in the middle of the ocean. It was Hantavirus. The virus, typically associated with rodents, may have passed from human to human aboard the MV Hondius, something that almost never happens. Almost. The Andes virus is the only known strain of hantavirus capable of spreading between people, and it was loose at sea among 150 passengers with nowhere to go. Days passed, then weeks. The ship kept sailing. More people got sick. On April 24, some 30 passengers, including 8 Americans, disembarked early on the remote island of St. Helena. About a week later, hantavirus was detected on board. Some of those early departures had already scattered across a dozen countries before anyone even knew what they were carrying. By May 8, the ship was carrying 147 people and sailing toward the Canary Islands for a 22-country evacuation. 3 passengers had died. 6 cases had been confirmed. The world was watching. Despite the objections of the Canary Islands regional president, Spain approved the plan for the Hondius to dock in Tenerife. Spanish Health Minister Monica Garcia described the planning to prevent hantavirus spread as unprecedented. But here is what keeps scientists watching closely. Symptoms of hantavirus can take up to 42 days after exposure to appear. That means the passengers who felt fine walking off that ship, smiling for photos, relieved to be home, may not know for weeks whether the virus made the trip with them. The WHO Director General told CNN he expects more cases to emerge. The incubation for hantavirus ranges from 6 to 8 weeks, he said, so we expect more cases to come. One public health expert put it plainly: if this was a highly transmissible virus, you could imagine what chaos we would be facing now. It wasn't this time, but somewhere between the frozen wilderness of Antarctica and the familiar shores of America, a virus that had no business being on a cruise ship found a way. And the passengers who boarded the MV Hondius looking for the edge of the world came home carrying a quiet reminder that some dangers don't need a passport, and nature doesn't always announce itself before it arrives. Thanks for watching. If you liked the video, hit the bell icon and subscribe our YouTube channel for more interesting facts.